Great, I think we can go ahead and get started. So good morning, good afternoon, good evening from wherever you're joining us from. Welcome to the fourth and final session of the Community Activation Dialogue series on the road to vaccine acceptance. Where is the voice of the community? Before we get started, I just want to remind everyone that we are using a Zoom meeting format today. So please do stay on mute throughout the session. If you have any questions or comments throughout the way, feel free to share them in the chat box or raise your hand as well. We'll certainly have some time for question and answer throughout. But without any further ado, I want to pass it over to Ahmad from the team, who's going to kick us off today. So over to you, Ahmad.
Thank you so much, Liz, for giving me the floor. Hello, everyone. A very good morning, afternoon, and evening, whatever the case is. Thank you so much, all of you, for taking time out and joining us for the webinar. Today's webinar is the fourth in the Community Activation Dialogue series, and almost that is the last one also. Organized jointly by the Boost community and People Power Health, over the next 1 hour, we will listen to various competent, renowned experts in the immunization space on a topic which has evolved into a major challenges for immunization professionals all around the globe, that is vaccine hesitancy. More importantly, the journey from vaccine hesitancy to acceptance. Where is the voice of community? And how can we unlock the potential of the community using community activation approaches? We have a packed agenda and have speakers from multiple countries who will share their insights on this very important and need of the time topic. We really thank all the speakers for joining us today. Finally, on behalf of Team Community Activators, I again welcome all of you and hope that the webinar is helpful in furthering our understanding on why the community matters and how it needs to be the fulcrum for all our efforts toward addressing vaccine hesitancy. I now hand over the proceedings to my dear colleague, Chinyere, blessings to provide us with an overview of the community activation approach. Over to Chinyere.
Hello, thank you, Ahmad, and thank you. Welcome, everyone. Am I audible?
Yes, yes.
Can you hear me, please? Okay. All right. So, as Ahmad has rightly said, this is the final webinar for the course community activation. This is the fourth one, and we thought it wise to share with you what do you have the overview of what the course is all about. As you well know that this is not the first course we are participating in. This course is particularly for community enabling. It is a place where after so many weeks of capacity building, we were equipped with the skill to be able to enable the community to be able to utilize the available resources that they have to achieve a desired goal. It is where we were equipped to be a propeller, more like, we are to propel communities to be able to utilize, first of all, to arrive at a shared goal. It has to be a purpose that they all have emotions concerning, they have feelings towards. So it's going to be a shared goal, and then they are able to utilize the available resources or mobilize even the ones they don't have to ensure that they achieve a desired goal or solve an existing problem. Next slide, please. Next slide. All right, so community organizing and mobilization and activation has different and several strategies. But because this is going to be a very brief overview, we're going to just look at 4 of them. we're going to look at coaching. Coaching is a method, a strategy by which we establish more like strengthen the community, equip them. This time changing the focus not to us, because this has to do with community mobilization and activation goes beyond immunization professionals. It is just a way of achieving a desired goal in a community. So here, when we talk about coaching, we talk about enabling the community to come to an agreed point, thereby harnessing their strengths, okay, to meet a desired goal. This time we're shifting the focus. Most times when we tend to activate communities, we tend to bring to them the problem from our own point of view. But in community activation as a curse, we were built to now turn to the communities, let them share their own perspective of the problem, and then by themselves generate strength, harness strength to be able to solve that problem. So that is what coaching is all about. And then we also talked about building relationship. Building relationship. This is just learning to develop public relationship. Because if we are to activate community, well activated community has this feeling that they need to build to be able to help them, overcome certain problem or to be able to meet certain goals. So in building relationship, we talk about learning how to develop public relationship based on shared values. Okay, specific common interests and mobilizing of diverse skills and resources to achieve those interests. So this is also a strategy to community activation. Now, the narrative is about gaining the interest of people through sharing your own story. The narrative is about telling the story of self, then of us, and then of now. As we all know, in public health, most times we are dealing with emergencies, outbreaks, things that we need to deal with urgently. And in activating a community, we need to tell them, we need to first of all share with them why we are doing what we are doing. That is the story of us, of me, my story. Why am I doing? Why do we have the passion? If we are talking about vaccine hesitancy, for example, like this team is dealing with that, we need to bring in the reason why me as a person I'm interested in ensuring that people are fully immunized and there are no vaccine hesitancy. Then we'll talk about the story of us. How does it affect all of us as a group of a community? And then we'll talk about the story of now. Why do we need to act now? The importance of the urgency of mobilizing the community. So that is about narrative. Narrative and storytelling is one of the strategy for community activation. And then the final strategy is when we talk about resource mobilization. Now, resource mobilization, we're not just talking about, a material mobilization. We also talk about human mobilization and the role and responsibility of each and every one of the community in activating this community. So these are majorly just few of the strategies that we use in activating a community. Let me just mention that in coaching, there are so many other steps to coaching, but we might not be able to go into detail of all these steps. But this just to tell you that we'll have one-on-one meeting and several other aspects where we need to coach the community to ensure that they're able, to activate their community and solve their desired goal. Next slide. Next slide. All right, so in context of vaccine hesitancy, which we all know that it is being fueled by rumors, misinformation, disinformation, and the stigmatization in the community. How does the community come in? What is the community supposed to do? Because the truth is that if we are able to get community well activated, a lot of misinformation, rumors, stigmatization will reduce. And then we are now moving from vaccine hesitancy to vaccine acceptance. So in the context of vaccine hesitancy, we are talking about being able now to harness either the big or the small, all the resources needed available in the community, and each and every member of that community understanding their roles and their responsibility. First coming to understand that there's a problem that needed to be solved, and then charting a way and strategy to solving that problem, and then harnessing the resources, and of course, delegating each and every person to be able to do his or her own part. And you know, when we say all hands are supposed to be on deck, that's what we're talking about when we talk about community activation and mobilization. Next slide. So if you look at this present slide, you can see community activator Adefunke and Chinyere. They're actually trying to do the work of community activators as we speak. Next slide. All right. So what is it about activating community when we talk about dealing with child killer diseases? We say, first of all, let's debunk the rumor. Let's manage the misinformation. Let's mitigate, stigmatization. For we community activators, what do? We build the community. We coach them. We establish relationship between us and then the community to understand the inherent problem and to form a way of solving them. And then we'll harness every resources in the community, and then we assign duties of force, and then we'll act. And that's when I talked about the story of now. We act. The issue of community health is something that cannot be made to wait. It is important that we act and then act fast. So this is the overview, more like a summary of what community activation course is. But let me say that this is not the first course that is being powered by People Power Health and the Boost community. No, it is just a course selected by few whose capacity has been built, their skill built to be able to go ahead and activate other communities. And this is what we are doing with this webinar. We're actually activating this community so that when you go back to your own context, you will be able to also activate your own community in your own context. It might not just be concerning immunization professionals. It might be other areas where you need to achieve a certain goal in the community. Okay, so that it's just a summary of what we have done for past few weeks. There's quite an intense training. And we thought that it would be great if we also just share with you the overview of what the course is all about. And that is it from my own end. I will be handing over to Mutwali, who will also introduce our other speaker that will tell us about the feats that have been achieved when community is properly activated and mobilized. Over to you, Mutwali.
Thank you very much, Chinyere. My name is Mutwali Adam. I'm delighted to take you through this session of how to unlock the potential of community activation to address vaccine hesitancy with our guest speakers. Our first guest is Raj Shankar Bush. He will take us through how to keep people at the center. We will hear some lessons learned from polio, measles campaign, and also innovation of community activation for COVID vaccination from India. Dr. Ghosh is currently working as senior advisor, vaccine delivery as GATE Foundation. He's a public health physician with 3-decade experience in primary healthcare and infectious disease. His primary interest in vaccine delivery, and also prior to joining the GATE Foundation, Dr. Ghosh was director of the regional vaccine delivery work for PATH in South Asia and Western Pacific region, with focus on new vaccine introduction. He's also served as coordinator for National Polio Surveillance Project of WHO in India, and he's also a fellow of Indian Public Health Association. Please join me to welcome Dr. Ghosh for the next session. Thank you. Over to you, Dr. Ghosh.
Thank you. Thank you very much. First of all, I really wanted to thank the Boost community for inviting me for this presentation. The topic that I will be addressing is unlocking the potential of community activation to address vaccine hesitancy. Before I move to the next slide, I would really like to begin with a very brief anecdote which happened very early in my career. When I was a surveillance medical officer in the World Health Organization's National Polio Surveillance Project in India, once I had gone to see a child who was suffering from acute flaccid paralysis. So after the investigation of the child, I had given the normal kind of instructions for the sample collections and filled out some medical instructions and handed over to the family. And as I was leaving, the grandmother of the child asked me whether the child had polio or not. So the child, was presenting itself clinically, absolutely with symptoms like polio. But I told the grandmother that, we cannot say anything now, only after, we have been able to see the, laboratory results, we will know whether this is a case of polio or not. As we are having this conversation, the grandmother was keeping on asking me, please tell me whether this is a case of polio. Suddenly, the mother of the child, who had not spoken, told that, doctor, you can rest assured, my child does not have polio. This is not polio. And I did not say anything, but I was not sure why the mother was so confident that the child did not have polio. It did look like polio. So after around 2 to 3 weeks, the results came, and yes, the child did not have polio. So I went to visit the house again, and when I saw the child was a little better than what it was before, and was lying on the mother's lap. So I went and gave the results and said that your child does not have polio. It is a very good news. Then the mother smiled and told me, I had told you that my child did not have polio. So I asked her, why were you so confident that the child did not have polio? The mother smiled and told me that every time the health workers came, I vaccinated my child. If I had vaccinated my child, how can my child have polio? So that was something that I learned very early in my career, that the trust that the community has on some things that we tell them around vaccines, around various public health programs. And we need to be very careful that what we tell to the community, how we build this trust. And can we go to the next slide, please? Okay, thank you. So the first thing that we have to understand is when we talk about, this collaboration with the community, particularly in public health, at the center, we must always have the people. There are 3 kinds of associations that we have. One is that we need to develop vaccines that are user-friendly, that have a schedule which the public can follow. The compliance part needs to be taken care of, that it falls within the schedule of their routine vaccination, that the number of doses that we give. So therefore, when there are 3 doses of vaccine, we try to make them 2 doses. For example, what we are doing with the pneumococcal vaccine, earlier there were 3 doses, now there are 2 doses and a booster dose. In terms of framing the policies that we have, those policies need to be public friendly. Particularly in the COVID times, we have seen how important it is to frame these policies which the public can accept. We must keep equity in mind. We must think of the affordability of the vaccine. We must think of whether there are some compensations, whether it is a monetary compensation, whether it is a different kind of compensation for any harm that happens, and what are the incentives that we can offer to the public in order for them to be motivated to accept the vaccine. And the third thing is that when we design the programs, we need to very clearly understand that these programs need to be community friendly and they need to have access to the vaccine which is developed for them. Can you go to the next slide, please? So therefore, when we engage with the community, one of the main lessons that I have learned over the past many years is that there are 4 steps that we need to follow. The first thing is that we need to learn the art of listening patiently to the public, instead of just going and starting talking to them, instead of giving them sermons about what needs to be done. We need to hear the public. We need to listen to the public about what are their challenges, what are some of the local solutions that they have, what are their practices, what are their, kind of daily routines, so that we can, as we said, develop, frame, and design the vaccination program around their needs, keep the people at the center. The second is we need to observe. We need to observe what the public want, what they are saying, what is their kind of demand. The third thing is that we need to proactively ask the people. We must ask them, we must make them a part of the dialogue. Many of the people do not want to speak out, but this is the opportunity in public health for us to proactively ask the people what they want. And once they have told us, we need to conform by putting in application some things so that they can, accept it. Can we go to the next slide, please? When we were looking at the polio and the measles program, and we went to the resistant areas and we asked whether why they were not taking the vaccines, there were 4 kinds of answers that we had. The first answer was, because I know or I have heard that there is something with the polio vaccine that will be harmful for my body, or I have heard that some neighbor has had a problem with the vaccine. The second is that because I want, which means that, I don't want the polio vaccine. I want a road built in my village. I want a hospital in my village. Why are you coming with the polio vaccine? The third thing that they said is because I cannot. I want to take the vaccine, but my timing does not allow me. So therefore, I cannot take the vaccine. And the fourth is because I will not, in which case, there is something that they resisted because of multiple issues where they thought that they were being neglected. Can we go to the next slide, please? These are some of the innovations that are there. I will leave these slides with you, where the program has tried to put in technological, non-technological innovations for addressing the community's needs, because they listened to the community, they heard the community, and they observed the community. Next slide, please. This is a slide that I want to put. This is from last week. There's a flooded area in India where vaccinators have gone out in the flood and vaccinated the children in the flood. The vaccination is not important, but the bonding and the trust that they developed with the community by showing that they care for them and they empathize for them. And that is exactly what is required. The vaccination is a kind of bonding that develops between the community and the vaccinator, and they move on for that. Let's move on. Next slide, please. I just want to leave you with this slide where, this is a very difficult terrain of a hilly state in India, where this health worker, who has been recognized by the government of India for a service, goes many miles driving a bike to deliver vaccines to this community, which lives in a very difficult terrain, and no one visits them except the vaccinator. This is what is the bond and the camaraderie and the trust that develops between the community and the vaccinator. Thank you for this opportunity.
Thank you very much, Dr. Raj, Dr. Gosh. We are really astonishing by your stories and also your experience. Let us go to the other part of the world. We have our dear colleague, Mr. Anu Rotimai. She will take us through the how to get community to lead. Mrs. Anu, she's founder and executive director of Center for Accountability and Inclusive Development, CIAD. She's a social and development activist and advocate promoting sustainable and inclusive growth as an integrated component of society together through people voice and action for human, social, health, economic, and environmental development by building sound and responsive system in Africa. Please, Mrs. Ano, you are welcome.
Okay, thank you very much for actually having me this wonderful and beautiful day. And when I actually received the invite to join this conversation, this invite from this team, I was very elated. And I also congratulate the Boost community for actually activating the voices of community members, especially the fellows of the community activation that just finished their course. And I'm privileged to be one of the alumni of the Boost community. Talking about the building on what Dr. Gosh actually said, I want to say that he has actually given an in-depth overview of what we need to do to actually get community to actually actively participate and improve the uptake of vaccine. One thing that is core is that for every policies, for every strategies that we have, we must actually make sure it's people-centered, people-driven, and people-owned. Next slide. I would like to first of all share that as of today, let's look COVID-19 vaccine for an example, that we have 6.2 million doses across the world, and just about that, only about 3.53 million people have been vaccinated across the world, and then we have about 65% of the global percentage being vaccinated. Then we have about 46% that have fully received vaccination. Now, right now, the daily vaccination has actually improved from 26 million to about 26 million. And then on the other side of the slide, we can see the vaccination trend across the continents. And we can see I'm actually of a particular interest to the Middle East and Africa. And you can see that Africa, as of yesterday, we can see that only about 69% of the people living in Africa have actually access to COVID-19. And one question I'll be posing to us is that, is this narrative actually different across the other vaccinations that we have right now? Is it the same trend? And why are we having this vaccine hesitancy? And what is the linkage between, is it that are we just having a vaccine hesitancy right now, or it has always been there? One thing is important for us to also get to mind is that vaccine hesitancy has been there like forever, but we've seen that the last decades that the acceptance have been quite different. Next slide. And people are tending to change their behaviors. But we also need to understand, why are people actually hesitant, not only to COVID-19 vaccine, but to other vaccine. We have, Dr. Gosh has mentioned polio vaccine, we have the measles vaccine, even the yellow fever vaccine. What are the reasons? We need to understand what are the concerns that people have. One thing that Dr. Gosh actually brought out clearly is the issue of lack of trust. In my home communities, during the pandemic, when the lockdown came out the lockdown was implemented last year, there was distribution of palliative. The government had to actually provide palliative, but citizens were not forced to actually receive the palliative. Citizens said when the palliative was shared, a lot of them do not have access to the palliative, things that could have actually make their life much better. They didn't have access to that. So why are we now forcing them to come and take the vaccine? It does not have any economic benefit to them. And this is coming from a population of people living below the line. So these are some of the key issues we need to Then we also have the issue of vaccine efficacy and safety. People are concerned about the consequences, and are we actually listening to them? There are also issues and concern about the poor, effective, and equitable distribution. Recently, when the issue about the COVID, the EU came about the recognition of one particular vaccine or not, it actually generated some sense of like saying, okay, so are we saying the people in some countries are not actually taking the right one? So we have some of these things. Then we have the issue of infodemic, and we have the people believing the virus does not exist. And we also have the lack of ability to make effective decision about vaccine. Next slide. Actually, to change this narrative, I'm going to be borrowing from the Brewers and Kapman survey that was done. It feels that for us to change the narrative, we need to actually engage with people. We need to understand what people feel. And when we're talking about what people feel, it brings the story of life, things about their emotions. Then the social processes, that the social norms that actually exist. Actually, we need to now talk about motivation, inspiration. We need to understand what inspires them. What do they really want to hear? What do they want to listen to? They want to bring in the practicalities of issues. And then when we can actually align the motivation along with the practical issues, then we can actually see people actually changing their behavior to getting more vaccinated. Next slide. Now, what I've shared here is actually a various array of how we need to actually activate community. One, I need to emphasize, we need to start communicating to people. We need to communicate science to people in the language they understand. Enough of we just dumping information on them. We need to communicate it to them in their own language. We need to identify and listen to concerns by citizens, by connecting facts and emotion. Sometimes in our responses to committee people, we just tell them what we want to tell them without actually answering the questions they actually want to get answered. We need to strengthen and sustain a responsive two-way communication. When they're asking questions, we also need to engage them in a conversation. That way, we're able to improve and create a channel for vaccine education awareness. We also need to involve and educate and leverage on the ability of our community and faith leaders. We've seen this work in various communities. For example, we have what we are trying to, various countries are using religious and community leaders to improve MNCH across countries. We've also seen a need to partner and integrate vaccination into existing interventions such as education and other social services. We need to continue to build trust and ensure that vaccination is actually people-centered. We must build a relationship that is built on respect, dialogue, empathy, and inclusion. And we must also invest in country-driven research and science. When we actually get people to know that it's about them, they have a say, and they're able to contribute to this science, taking what I call indigenous knowledge into consideration, it changed a lot of narrative. We must collaborate and get people more involved in designing and developing and driving communication strategies. For example, how did we engage people in designing the social mobilization plan for some of our vaccine integration? So we need to start thinking and getting them involved. Then we need to actually encourage the government to be more accountable and transparent in everything they do. And lastly, I'm going to say that we also need to leverage on indigenous technologies and resources. These resources actually are available across various communities. We just need to narrow it down to be able to get it closer to the people. And last slide, and I think on this note, I would love to say thank you for giving me this opportunity to share. And I really look forward to translating some of these things with everyone into actions as we move forward.
Thank you very much, Mrs. Sano. Our next session will be led by our dear colleague, Dr. Adefunke. She will take us through the scope of and spectrum of community activation with panelist discussion, and also welcome Adefunke and the panel. For the floor is over to you. Thank you.
Thank you so much, Mutwali. As he earlier introduced, this is the panel discussion aspect of the presentation. Today we have 4 panelists, and one of them, I'll introduce them briefly, and we'll start serving the questions. So I'm first of all going to introduce our able teacher, Dr. Pedro. Dr. Pedro is an executive director of People Power Health, a group of community organizers and trainers focused on bringing the social movement and community organizing skills to healthcare professionals, caregivers, and healers. In the past, he was a project director of Freeport Foundation, working with the hospital system, Center for Public Health Leadership, Primary Care Progress, Healthcare Anchor Network, and many others. As a lifelong activist, he currently serves as on the advisory board of Leading Change Network, one of the largest global network of social movement leaders. Dr. Pedro earned his Master's of Public Health, MPH degree from the Harvard C. Chan School of Public Health, and a medical degree from Belgrade University School of Medicine, Serbia. Dr. Pedro is an instructor at CHN, the Harvard School, teaching 3 courses. The courses are enabling teams, enabling large system change, and narrative leadership. This is just short brief about his profile, and I know you had had a contact with Dr. Pedro before. You know, he's a potential discoverer. He will point at your areas of discovery. So nice having you here today, sir. The second person on our list is Elizabeth Holloway. Elizabeth is the Senior Manager of Community Building and Digital Engagement at Sabin Vaccine Institute, managing the Boost Community's online platform, Boost Community Organization, an extensive network of immunization professionals around the world. Currently, she leads member recruitment and engagement for the online platform, including hosting multiple trainings on adaptive leadership and community organizing. Prior to Sabin, Lizzie managed external affairs for a global health advocacy and membership organization. Permit me to welcome Madam Elizabeth to this panel. Thank you. This is a short profile of our own as well. The next person is Dr. Emmanuel Musa. Dr. Emmanuel Musa is a public or global health professional with 18 years of immunization experience. He is an alumni of multiple courses offered through the Boost community, the Geneva Learning Foundation, and other platforms. Courses completed by him include C3, that is the Strength of Trainers, the Adaptive Leadership, the Immunization Agenda 2030, Storytelling for Change, Community Activation Series, Reach Every District, Quality Improvement, etc. These are the few of those training that he has taken to improve his knowledge and to add his skill. He is also a member of Technical Expert Committee on COVID-19. Dr. Emmanuel is keen adaptive leadership, democratizing leadership, and responsiveness feedback approach. Permit me to welcome Dr. Emmanuel Musa. The last person on is Dr. Muhammad Imran Quraish. Dr. Imran is a public health expert with 13 years of experience in the area of public health. He holds a position of immunization focal officer at WHO's office in Pakistan. He has worked in multiple capacities across areas of maternal and child health, facilitated different capacities building training in the same scope, such as mild level managers, course for EPI managers, EPI managers, and supervisors. The maternal and child health, the adverse effects following immunization surveillance, data quality improvements. Dr. Imran is a reviewer for EPI, EPI at various levels. He has published many surveillance bulletins, and his core competencies include data analytics. Dr. Quraish is a member of different professional platforms, an active member of Boost community, where we are today, where he has undergone several trainings on immunization, EGT to Reach, Immunization Agenda 2030, EIR, Electronic Immunization Registry, Adaptive Leadership for Immunization, COVID-19 Peer Hub, and the like. So the team should also join me to welcome Dr. Muhammad Imran Quraishi. Thank you for honoring our invitation. At Dr. Pedro, first and foremost, I would like to say thank you again for you to have provided all of us with this very wonderful opportunity of participating in the course on ADAPT Advanced Training for Community Activation. You, Dr. Pedro, sir, have been a long-time advocate of keeping the community at the center and of letting the community decide what is needed and important to them. We would love to understand as to what provoked you to champion the cause of community activation, including the cause. What have you learned leading this effort? And what, of course, we kept on seeing challenges. What are some of the challenges that you have seen or you've said or you visualize? Will also be good for the participants here today to understand how the tools of community activation can be used to address immunization challenges. Thank you. Over to you, sir.
Thank you, Adefunke, and good morning, good evening, good afternoon, wherever you are. As Adefunke says, my name is Pedro, and I'm an executive director of People Power Health and a professor here at Harvard School of Public Health. But quite honestly, it's such an honor to be in this space, because just seeing like almost 50 people in this capstone webinar that the community activators teams have like organized is an amazing testament to the power of the skills that we are teaching. So to answer that question, Adefunke, I think, you know, it goes back. I have to, like, I'm currently in the United States, but I'm not from the States. I'm originally from Serbia, from Belgrade. And actually, I was born in Yugoslavia. That was a long time ago, when that country still existed. And in the 90s, during the some troubles that we have in that country, there was a big civil war. For some of you, if you remember, in the Balkans, and I was in high school at the time. And what was interesting about it, there was also at the same time a huge epidemic of HIV/AIDS in Eastern Europe emerging. And our government were so busy running a war, they didn't do anything about the epidemic of HIV/AIDS. And as a high school student and later medical student, we kind of felt the need to do something about it, because there was nothing. There was no programs, there was no medication, there was literally nothing, no prevention, none of that. And, you know, we started a peer education program. We started to work alongside with the community. To be quite honest, we were the community. It was not even that we were working with the community. We were those people who needed that trainings and access and things the most. And it was really powerful. And through that experience, I've learned that there's actually a way, you know, honestly, we organized the whole parallel structure to the government, because government was doing nothing and everything was on a voluntary basis. It was just activating the power of the community and the people. And I got the bug. I hooked on the idea that some of the challenges that we already have the resources to do it. Like, for example, the peer education program, it was young people who were trained to deliver it to every school in my country, like the education programs about prevention, about, you know, treatment, about everything that we could do. We even started a harm reduction clinic, you know, at the time, which was unimaginable to see at that point in time. So anyway, all of that to say is that we did it ourselves, but then later on, I've learned that there is actually a long history of doing this type of work of community activation and community organizing. And guess what? It started a long time ago, 200 and even more, 2,000 years ago, when people started doing the organizing in different faiths, in different communities, in different tribes, in different places. And there are ways, there are skills, that's like I've learned later, that are transferred from one generation to another about how do you build a movement, how do you work not for the community, but with the community. And once I figured that out, I realized that during my medical education and public health education, there was not a single course, not a single kind of like interaction to teach us how to do that stuff. And it was really interesting that there's this long tradition of how you do it, and then medical professionals are not exposed to that. And part of it is, honestly, my mission today in life is to bring those skills to the immunization professionals, to the health professionals, to our healthcare community, because I think the problems that we are facing, including COVID right now, they cannot be solved if we are not activating the community overall. And I was really pleased to hear Dr. Ghosh talking about this idea of kind of like, how do you work with community and how do you solve the problem and build trust? Because the solutions are not in our hands anymore. They are in the hands of the people we work with. And there are skills to do it. And those skills were the skills that we were teaching in the course. Some of them, just to mention, Chinyere did a beautiful presentation at the beginning, explaining some of them, like relationship building, storytelling, coaching, building teams. You all work in teams. And then kind of like having a strategy and campaigns to activate and work with the communities. So I will stop there. I know you have other panelists, but it's the idea behind the work that we do at People Power Health, and generally the work that we do with the Boost community as well. Back to you.
Thank you so much, teacher, the grace of the teacher of teacher. I think for the participants, because of the time, I may not be able to do a very complete recap on what he has mentioned. But I would like to implore each and every one of us that we should try as much as possible to gather our question, put on the chat. We may give 1 or 2, 3 people opportunity to ask it directly from the panelists, while others may try to put it on the chat so that our colleague will pick it up from then, so that we can have our question answered. So I will quickly go to Elizabeth to give us his own view concerning this question I'm about to ask her. Lizzie, I think you're in the house. Hello, Lizzie. Are you there?
Yes, I'm here. Yes.
Thank you so much, Lizzie. Yeah. Elizabeth, thank you for setting up the community, the Boost community, you and your team members, the other management team. The Boost community, no doubt, is like a rainbow today, a community which brings together immunization professionals from all over the globe, of which we are here, part of those people. The perspectives, experience, and expertise is what cherishing indeed. What would you like to know today? What we would like to know from you, from your hand today, is how you and your colleague visualize the community. The community best contributes. What do you think that the community will best contribute to? And what have been some of the specific efforts by the community towards addressing vaccine existency? Thank you, and over, Lizzie.
Thanks so much, Adefunke, and thanks to the entire team for including me in your presentation. So maybe just starting off with how we visualize the community. So before Boost came into existence, the Sabin Vaccine Institute supported another community of practice called the International Association of Immunization Managers, which some of you might be familiar of. So the network came together at annual conferences and used a dedicated website, mostly as a member directory and a collection of resources. However, there were some limitations that prevented the network from being dynamic and responsive to its members' needs. So Sabin envisioned that our new network of immunization professionals would be a community not only built for, but also built by immunization professionals. We also wanted this community to encompass all the individuals involved in delivering life-saving vaccines. So that's kind of why we broadened the term from immunization manager to immunization professional. So within this ethos, in 2019, the Boost team conducted several focus groups in East Africa and also disseminated a series of surveys to existing global network. And through these channels, the team surfaced challenges faced by immunization professionals, from staff turnover to inadequate leadership and management trainings. Moreover, immunization professionals reported a desire to connect more with their national or subnational counterparts. So, these components, these foundational components of Boost to connect, learn, and lead were really derived from some of these early and essential conversations. And then just in terms of where the community can best contribute, I think there's 2 ways in particular. So One, participating through our live engagements and courses where you can share your experiences and learn from your peers. So as Adefunke mentioned, we do have a growing network right now. We have over 1,700 members from more than 130 countries. So there's definitely a lot of expertise and experiences to tap into. Also, just your contributions, especially around the rollout of COVID-19 vaccines, which is a new space for everyone, are really valuable to your peers. And I think together we can work through some of these challenges and also raise our voices to global partners who really want to support the work that we're doing on the ground. And then secondly, Boost members can also identify, who's missing from our community. So growing our network makes our community not only more inclusive, but also more diverse. So definitely would encourage everyone to spread the word to your colleagues to join Boost. And then I think the last part of your question was around our specific efforts by the community to address vaccine hesitancy. As I mentioned, our community comes together on a regular basis to address challenges like vaccine hesitancy. And I would say this event today is a great example of that. We also have our COVID-19 listening and learning series, live engagement and podcast series, which is really important, I think, to, before moving on to our action is to actually start, pause and listen and to understand the issues that are going on. And that was, I think, brought up very well by Dr. Ghosh just a few minutes ago. And then also, telling a story. So the Boost community offers a self-paced storytelling course to its members to really hone some of these storytelling skills and to help us become better communicators to our community. So I'll pause there. I know there are a lot of great strategies to address vaccine hesitancy. And I know we have a few minutes left, so I want to hand it back over to you, Adefunke, so we can get to our other panelists. Thank you.
Wow, thank you so much, Lizzie. Really appreciate your response to our question. Yeah. Hello, can you hear me? Hello?
Yes, we can hear you.
Yes. Thank you so much. Before I go to the two other panelists, I think I'll say that by now we have heard from Dr. Pedro and we have heard from Lizzie. And from Dr. Pedro, we discovered that it's exactly all about story of how he developed that kind of interest in the East area. And aside that, I think he also identified the gap also in some area, especially in the health, and he is just trying to build up on it. And he's also using his own, his own area of interest to develop for others. That's what most of us are even benefiting today. And go to the Boost community. We have Lizzie as part of the management member of the Boost community, of which also she has also let us realize that the platform was created in 2019 for the healthcare professional, especially the immunization champions. And she has also stated most of their challenges and what they have achieved so far. So thank you. Please, if we have one or two questions for them, please let's try to put it on the chat so that our colleague will quickly pick it up and get it to them. Then, if the time permits, we're most likely going to give few people a opportunity to ask directly. Thank you. So let me go to Dr. Emmanuel. Dr. Emmanuel, please, I will also say thank you to you to have honored our invitation.
Adefunke, if I can comment.
Hello, can you hear me?
Yeah, sorry, Gunjan, this side. I think we are pretty short on time. So if it permits, the description is or the introduction is already there on the slide. If you can directly go to the question.
Sorry, I should go on. Dr. Emmanuel. Hello, Dr. Emmanuel, can you hear me? Am I audible?
Yeah.
Yeah, thank you.
Yeah, can
Dr.
you hear
Emmanuel,
me?
please. You have been a very active member of the Boost community. You have actively engaged with other members and participated in multiple training and courses in the Boost community. Do you feel that this course on community activation has been different, and what have you gained from it? In addition, you have been, actively engaged with community mobilization efforts in Nigeria. Has this course introduced you to a different facet of social mobilization? And how do you think the principles of community activation can be used to address vaccine acceptance? Then it will also be nice, it would be great if you have some personal experience to share with us today. Thank you, and over to Emmanuel.
Yeah, can you hear me?
Yes.
Hello, Adefunke. Okay, fine.
Yes, I can hear you. Can hear you. Thank you.
Yeah. Nice for the community activators to have me on this laudable and important webinar. And just like what you could see, this is different from all the normal 3 webinars that we've had. In fact, when I saw the invite from Dr. Gunjan, I knew this is something coming in very unique from the normal presentations. It has taken a very new dimension of what we are doing here, and then the experiences we've shared from the community. Now, yes, the books have actually exposed us to a highly skilled, trained session, which is almost 4 months ago that we started this course. And every person or every scholar or every out of those activators that have been part and that were trained by the People Power and Health and in collaboration with the Sabine and Bush community knew that we have actually gained tremendously with such a faculty and minded, serious people who had put us through. Just like what you have said about Pedro, we knew he's someone who can bring out from the worst from you and bring out the best for you. I've had that session from him in one of the storytelling sessions I've had. At the time, I said, I don't have a story. He kept me into a box. And I never knew until when I realized that, yes, I had a story. And that story, it's actually one of the best I've had. And it's so emotional, I've said it severally. Now, this is different from every other platform that we have had. This is different from every kind of courses we've had. This is intense. This is encouraging. In fact, I actually don't have words to compare because there's no need to compare between these courses that we've done, most especially the one in Boost. Is it all about the adaptive leadership? Is it about I've done community activation series, but the advanced community activation seems entirely different. And that is why you could see all of us as professionals, every now and then we are glued to immediately we see that there are courses. And I could say this very, very seriously to some of our professionals at the Adefunke, Doctor. The course is not as big as probably you get 500 participants, because this is not the kind of course we envisage. The Boost platform is transforming because it's activating and gradually becoming in. And from this course, I knew that if I should be able to go through to my experience, and I would be able to see how I can activate more members, how I can train and coach and mentor, just like what we've been taught by some of the facilitators on those courses. And you could see this is how I've done well. And because of time, I might not be talking. I please just share a few of my experiences where presently I'm in the field and I'm sharing. I'm doing so much in trying to activate community. I'm trying how to engage community. I want to thank you for allowing me to giving me time to talk to you at this moment. Thank you, Dr. Gunjan. Thank you for the Adefunke. Thank you.
Really appreciate that. Dr. Emmanuel, we really appreciate that. I would like to go to Dr. Imran Quraish to kindly provide to us his own view for this question. So, Dr. Imran, thank you for honoring our invitation today. We truly appreciate you taking time and for this webinar. As a program leader in Pakistan, Dr. Quraish, sir, you are engaged with multiple aspects of the immunization programs. It will be wonderful to get your insight into if and how vaccine hesitancy continue to challenge the progress of the universal immunization programs. in Pakistan. What are some of the approaches that have been employed to address this, and how can community activation approaches be useful in addressing vaccine hesitancy? Thank you. Over to you, Dr. Imran. Right.
Thank you very much for providing this wonderful opportunity. Hope I'm audible and clear.
Yes, sir. Yes.
Yes, yes.
So thank you very much once again for this wonderful opportunity to speak to the world scholars on this important immunization challenge. First of all, vaccine hesitancy and its worst form in terms of vaccine refusals is a real big challenge for the immunization professionals across the globe. And this challenge is getting worse, especially in the learned communities, because of certain concerns and beliefs. But it is also there in underdeveloped countries like Pakistan and other parts of the world. So if we can just broadly divide and categorize the different vaccine hesitancy and refusal cases, we come across the biggest reason still remains misconception, which is 33%, followed by the second biggest reason. In terms of Pakistan and in terms of polio campaigns, unfortunately, Pakistan is still among the two last countries who have to eradicate polio along with Afghanistan. So the repeated campaigns in terms of polio campaigns is the second largest contributor towards vaccine hesitancy and refusal. It is around 32%. Then in third in the list is the religious refusals. And it is around 17% because of various religious beliefs. And then in the list, we also find some of the chronic refusals, which are although 3%, but chronic refusal in each and every campaign are probably the same cohort, which is missing the vaccine and developing the susceptible pool and are basically the source of spread for the infection. And there are other reasons also, like we could say there are having certain medical beliefs, medical reasons, like some other demands, some beliefs, and some medical related and vaccine efficacy related issues, some related to the safety issues. So these are various contributory factors. But let's discuss the other aspect. What efforts have really been made in Pakistan to counteract this huge challenge with regards to polio and with regards to the other mass vaccination campaigns like measles. So the good news is, basically we had collected so many data profiles, different data sets and different aspects of this challenge that we are in a position to look at the data, deep dive, and have a comprehensive analysis and come up with a solid strategy to counteract this important challenge. So one of the challenge which we developed is basically the development of a communication network within the country at the district level, then below, even at the community level, where the social mobilizers are still there to address the community reasons for this vaccine hesitancy and refusal, and provide them the scientific and real-time, real information by which they can convince the community to come and get the vaccine. In this way, the demand generation is improving and the refusal rate is going down and down. You can see the chronicity is only now 3%, mainly because the communication network is doing wonderful. We have done, not only took the religious scholars, different sects on board, get their like consensus on this vaccine efficacy and effectiveness and the importance of the vaccine. And once they are agreed, they issue their own documents, they issue their own convincing material towards the community and towards their believers. And then we are converting refusals into the vaccine acceptance people. Likewise, we are also having certain local community level jirgas, and those jirgas like contributing towards dealing the vaccine hesitancy and converting them into acceptance. So there are various efforts already been made, but to summarize these efforts, not only we have worked in guidelines development, in conducting various community sessions and converting all those refusals into the vaccine acceptance people. So to cut the long story short, I would say the vaccine hesitancy need to be scientifically dealt across the world. Look at the reasons, look at the cross-cutting aspects, and go into the root cause analysis. And whatever comes out as a lesson learned, we need to align our strategy accordingly and then go for it and see how much impact we are getting from those strategies so that we can tailor our strategies and can address all those challenges once forever. Thank you very much. Over.
Thank you so much, Dr. Imran. At this point, whoever has questions should put on the chat. Our panelists will see there. I would like to hand over to our team lead, Dr. Gunjan. Thank you.
Thank you, Adefunke. Thank you, everyone, for this wonderful wonderful hour that all of us spent together. We are much over time, but thank you, everyone, for staying back. A big thank you to the Boost community for providing us this opportunity, to the People Power Health team for conceptualizing, designing the course, and again, giving us the opportunity to participate it. To all the speakers and panelists, a big thank you from all of us, especially to the participants for taking time out to attend the webinar. To the immunization stakeholders all across the globe, we are essentially one family working together to achieve a common goal. To the entire team, Ahmad, Chinyere, Mutwali, and Adefunke, thank you so much for all your effort and coordination. And finally, a big thank you, though we also are a part of that community, but to each and every person out there who is somehow or the other connected with the immunization program as a service provider or as a beneficiary. And often we end up playing both the roles. I was recently in a call with where one of my senior colleagues, Dr. Saurabh Sharma, who works as a senior advisor at CHAI, made a very powerful statement that the community should be the arbitrator of the choices or the decisions that it needs to make. I think that sums up the entire crux of genesis of this course, and why, in fact, all of us have come together to address the issues of immunization and also other health programs. So thank you again. Thank you, everyone, for taking the time out. Pedro, if time permits, we can go for that picture. If people can just turn on their cameras for a minute, else we can close it. And
we can do a group photo, like, so if people can turn on their cameras, we can actually take a picture together.
And this draws the curtain on the community activation dialogue series, but it's not the end, it's a start, and look forward to many such interactions subsequently.
Yeah, but I don't know if you have the time allowed to reply to one question. I don't know if possible. For 1 minute, Dr. Pedro.
So Lizzie, please, can you grant us that, Lizzie, at least one question for Dr. Pedro or one of our panelists? Yes.
Yeah, sure.
Thank you. Thank you. So, Mutwali, please, can you put...
Yeah, yes, I can. Yes, sorry. Hello?
Please go ahead, Mutwali.
We can hear you loud and clear. Yes, we can hear you loud and clear.
Yeah. Yeah, the question from Nada Ahmad, monitoring could inform community activation intervention. Any idea about the best tool approaches, especially in developing countries and contexts? Maybe Dr. Pedro or Liz, maybe you can answer this question in 1 or 2 minutes.
I didn't hear the best tools and approaches for what?
Approaches for community activation interventions.
Social media monitoring
maybe not that she's online. She can also.
I'm just wondering on the importance of monitoring of the social media to inform the activation of community, and if there is like best tool or approaches that we can use and apply for that. Any ideas?
Yeah, I will have to pass on that question to Liz because I think she has a little more experience than I am with social media, but I'm happy to provide some thoughts about how interaction with social media can help like activation on the ground. So Liz, back to you.
Thanks, Pedro. And actually, we are working with a couple groups, including Facebook and the Bay Area Global Health Alliance, on a series of live engagements coming up soon to address kind of vaccine hesitancy in the social media space. So definitely stay tuned. We'll be bringing in some experts to kind of address that topic. So definitely sign up for the Boost community newsletter. I think our first engagement should be coming up later next month.
That's great. Well, there's a solution on the side of kind of like community activation on the ground. Like social media is one of the tools that you can use to reach out to people. I think where the sometimes the problem becomes is when people confuse the action on the ground with the action online. And those are two different things. So if you see people being active online, it doesn't mean that they will actually be active in the communities. And, you know, in these days, like rarely the activation online leads to the trust in real world. So you have to be really careful not to confuse the two. But I'm really strongly encouraging people to use the social media as a tool, not as an end of your activation. So it's a tool. It's not kind of like the final way to activate communities, because there's a difference between what's happening in real life and what is actually happening online. So keep that in mind.
Thank you.
I don't know, the time is allowed or yes.
I think we do need to close now because we are, I think, 15 minutes over.
Thank you.
So thank you again, everyone, for joining in. Liz, if you want to click a picture or something, and it's been a great 4 months. Thank you again, the PPH team and the Boost community for the opportunity.
Too fast 4 months.
Wonderful. Thanks, everyone, and have a great day.
Thank you. Bye.
Thank you, everyone. Bye-bye.